Gum disease is fairly common. A lot of us have experienced it to varying degrees. But what are signs of gum disease? We all check out our own oral health in the mirror when we're brushing and flossing. But what do we need to know? What are signs that could be indicative that you may be experiencing a stage of gum disease? And to answer that question, we have Dr. Pashmini with Serenity Dental. Welcome.
Thank you very much.
All right, gum disease. We've all thought about it. We're all wondering if we have it. What do we need to know?
Well, to start off, gum disease is one of the most underdiagnosed conditions in dentistry. So go 20 years ago, it wasn't diagnosed. People didn't know much about it. These days, we're finding a lot of links between gum disease and other systemic issues. For example, if somebody has diabetes, it's linked to having gum disease. So if you treat the gum disease, diabetes gets better. It's a lot of systemic conditions that also go hand in hand with gum disease. Now, as far as the signs of it, that as a patient, what are you looking for to see if you have gum disease or not? One of the main signs of it is bleeding. If you're flossing your teeth and if you're brushing your teeth and the gums are just gushing blood, or you're always seeing pink in the sink, that's a sign you have gum disease, or at least it's something that you want us to check it out. Maybe it's only a very small area of the mouth that needs treatment. Maybe it's mild. Maybe it's the start of gum disease. A lot of times when it's the start of it and we can catch it early, we can actually reverse it. We can treat it and then we can monitor it and maintain it so that it doesn't become periodontitis, which will involve the bone underneath the gum layer. So our teeth are inside our jawbone and then everything is covered up by gum tissue. Usually when things are stuck under the gum tissue, it eats away at the bone. When the bone goes away, the gum goes away. So patients might start even noticing receding gums. If you're looking and you're seeing gunk in between the teeth under the gum line, again, areas that are bleeding, that's usually a sign of gum disease, and we have to clean it. It's like a physical removal of the bacteria and all the gunk under the gum tissue, which is also referred to as a deep cleaning or scaling and root planing. And once that's all cleaned up, then we will talk to you about home care. We will talk about how to maintain that level. Unfortunately, once we lose bone, it's very hard to gain it back. Bone is the foundation for our oral health. So if you don't have bone, teeth get loose. They cause a lot of cavities in the teeth once the roots are exposed. So it's a dominoes effect. We like to catch periodontal disease, gum disease early on so we can effectively treat it and prevent it from getting worse.
Wow. Definitely sounds like a potential cascading effect. So in the end,
Absolutely,
early
yes.
signs that you identify, better to get it treated sooner by a dental professional. Otherwise, it could potentially have the long-term impact that you just outlined.
Exactly. So if you have bleeding, if you have tenderness in the gums, that's not getting better. Just swelling in the gums, bad breath, receding gum line, all of that will point us towards gum disease.
Got it. Well, very helpful. So a lot of folks who obviously are experiencing this, very insightful topic here. So Dr. Pashmini, appreciate your time as always, and very insightful for everybody listening about gum disease.
Of course, my pleasure.
All
Have a
right.
good day.
Take care.
Thank you.